Turning now to the deadly Ebola outbreak in Central Africa, where cases continue to jump. The outbreak claimed lives of more than 200 people in DR Congo and Uganda, with nearly 900 confirmed cases. And now the CDC says it's activating more than $100 million in emergency funding to strengthen its domestic and international response to the outbreak. CBS News foreign correspondent Ramy Inocencio continues his reporting, joining us from western Uganda, close to the DRC this morning. Ramy, good morning to you. How concerned are health officials where you are about this rise in cases, and do they expect numbers to continue to rise?
Errol, yes, good morning. Health officials are absolutely concerned, and they are still expecting these numbers to rise in terms of confirmed Ebola cases, as well as in the number of deaths. The Africa CDC has put out a couple new data points this morning. One, you mentioned that number of confirmed cases hitting nearly 900. They put that in relative terms. They said that that is up by nearly 40% from this time last week. Last week we had about 500 or so cases. Now it's nearly 900 cases. In addition, they're saying that this is on track right now to be the worst, fastest outbreak at this point in time. I want to wind you back because on May 15th, that was when this Ebola crisis was declared. Over that month and a week or so, back in 2000, there were only about 300 or so Ebola cases in that outbreak across the region. Now, again, we're pushing nearly 900, so that's nearly triple the number in the same amount of time. I'm also reminded that earlier this week, the head of the African CDC said that he's expecting more than 33,000 confirmed Ebola cases after this is all said and done. Put that into perspective, Errol. The last worst outbreak, they had 23,000 confirmed cases and more than 11,000 dead. That was in the West Africa outbreak about a dozen years ago. On top of that, one more number, and I'll head back to you. Contact tracing, hugely important here. They're only at 15% or so, and they say that based on that number, there may be up to 35,000 people out there unaccounted for that they're trying to get to who have been exposed to positive Ebola cases.
And that's a dire situation, Ramy. We mentioned the CDC is activating $100 million to help in the response to this, but I'm wondering if that's too little too late, because health officials where you are facing multiple challenges in trying to contain this outbreak. Just lay out for our viewers what they include.
Absolutely. I don't think anyone is saying that they're not facing a myriad number of challenges, Errol. One, everyone is saying here is information and awareness, and then on top of that, funding. But they both go hand in hand. You can't really have one as well as you might want if you don't have the money for it. Case in point, for information, we were going and visiting two refugee settlement camps, one to the south of us named Changwali Refugee Settlement Camp, one to the north called Kiriandongo. All told, they have about 300,000 people from Sudan, from the Congo, from other regions, trying to get away from conflict. And they say that 1 out of every 5 people don't even believe that Ebola is real. They think that Ebola is a curse. They think that you're bewitched if you have Ebola. So that's coming up against this ritual or this mistrust. In addition, if you don't have the money, they're saying, you don't have the money to hire workers for surveillance, to hire aid workers to try to take care of people. And it comes to the very basic point that if you don't have money to buy fuel, you can't even go to those outbreak sites, and you can't even print the paper for the public awareness campaigns to actually spread that information. You know, you mentioned that $100 million or so that the US CDC is sending out, but that is more reactive, Errol, than it is proactive. Everyone here is saying, listen, you never should have pulled money in the first place. I asked a lot of folks here, from government officials to healthcare workers, if you had a message for President Trump, what would you say? You know, first they smiled and they said, oh gosh, you know, first we want to thank the American people for past help, but over the past year they would say, President Trump, please open your heart. That was a line that they kept saying, open your heart, and then open funding.
All right, such a serious issue. Ramy, we appreciate your reporting. You and the team stay safe there.